Later in the State of the Union address, the President went on and talked about the importance of community colleges. Getting community colleges into a place where they're not just a pathway to a four-year college or university, but also making sure that they are accessible to veterans, making sure that they provide an opportunity for people who are not interested in going to a four-year university to develop skills, develop knowledge that can allow them to go to work in a short, relatively short period of time. Harold Martin, he is an adjunct professor at Pasadena City College. He is a Vietnam veteran, a decorated Vietnam veteran, and you're working at the Veterans Center there, and you're helping young folks like these make the transitions.
That's
What's
right.
it like these days?
What's it like in terms of helping veterans?
Yeah.
Well, I'd say it's fairly daunting for most of the educational institutions right now. It's the first time in years that they've had a veteran population to speak of to even deal with. And so we have a lot of staff that have never known anyone who's been in the military, know nothing about military culture, and suddenly we're seeing huge numbers showing up to use their GI Bill. Right now, 75% of the veterans using their GI Bill in California are at community colleges, and the community colleges really are not geared up to deal with this influx. So what it's like is to make up for some lost time, and to, in a time of dwindling resources, to allocate whatever we can to meet the needs of this very special and deserving population. I think my campus is doing a great job, but we need to have other campuses do a great job as well. We
have dealt with the returning veteran situation a number of times in the past year here on Midday Sunday, and every guest that we have had has spoken highly of the program at Pasadena CC and kind of disparagingly at others. It seems as though PCC's program is the model for what they should be throughout, not just Southern California, but the country.
Well, if I could immodestly respond to that.
Of course.
It's true. But I certainly do not deserve as much credit as others, and it's been a collaborative effort.
And one of those people is your wife, Patricia Orange Martin.
Right, who coordinates our veteran services.
Right. You both were at PCC originally?
Yes.
Yes. What did you find there? I guess you got there relatively soon after you got out of the military?
Yes.
Yeah. Megan, what did you find there? What was it that helped you make the transition there?
Places like the Resource Center at Pasadena Community College, they offer that transition process through your friends that you make there.
Aaron, we were talking a little bit earlier. You had a difficult situation because of you were working as a corpsman.
Correct.
But when you try to bring those skills to the civilian world, well, tell us how it worked out.
Well, as a hospital corpsman, you're trained to render medical care, more specifically emergency medical care, and that depends on what kind of NEC, which is the Naval Enlistment Code that they train you for. The majority of able-bodied male hospital corpsmen will go to the Marines as 8404 is the NEC.
That's the MOS, Military Occupational Specialty.
Right, Field Medical Technician. And so what you do is you just learn how to basically survive with the Marines. You do everything that they do. You go to another school that's kind of like a secondary boot camp, so that they can prepare you for the rigors of being attached to a Marine Corps unit.
So you're dealing with tough, we need care right now, medical kinds of situations. It would seem to me that it would be a fairly smooth and easy transition to begin working, for example, as a paramedic or an EMT.
Well, theoretically, you think it should be, and most hospital corpsmen have the ability, have the training to go ahead and do something like that. Unfortunately, when you get out, you don't meet the state certifications, or you don't meet the, well, mostly the state certifications, I would say, to be able to work in that field anymore. And although you have the knowledge and the experience, and when I say experience, I mean extensive experience, because that's what you're doing for years. You get out, and for example, I couldn't draw any blood. I drew thousands of bloods, and I couldn't get out and even draw somebody's blood.
Simply because of the way the laws are structured.
Right, correct. And
that had to have been very frustrating.
Extremely frustrating, extremely frustrating. And so what I had to do is decide, is this something that I want to continue to pursue, meaning that I would have to actually go back to school, start over again.
From scratch.
From scratch, even though I already had the knowledge and the training. And during that training period, I would have to find another way to survive.
Exactly.
So I decided, well, you know, I think I'm going to try something else. I'm going to go to school. I think that was the best route for me at the time.
You did a lot of work at PCC, and you're now at Pepperdine
University up in Melville.
And you're not studying medicine, I would guess, or anything related to the health science. What are you studying?
I'm actually a political science major, and I'm trying to get into the law school up there. So that's my ultimate goal.
And that would lead perhaps to public service and politics, and you can pass legislation to change all this stuff. How's that for a transition?
Sounds good to me.
Doc, how typical is this? And how much talent, good talent, is going to waste?
You know, I'm sure that it could actually be calculated, but just as a general statement, we've got all of these corpsmen and medics who've been trained in the last 10 years and who've proven themselves that they can handle the most dire emergency situations, that they're willing to sacrifice their lives in order to help people. The taxpayers have spent millions of dollars training them, so they're competent, they're motivated, they have the experience. They come back to the U.S., they want to get to a nursing program, and they'll be starting at ground zero. They'll be competing with an 18-year-old. They will be, we have a medic who didn't get in the nursing program because he got a B in his English class. To lose these resources, it'd be one thing if we were up to our necks in nurses in this country, but they're in short supply. Trained nurses are in short supply. Here we have this huge body of people that are committed, dedicated, and trained, and it's just a lost resource. We paid for their training, they've sacrificed the time and the effort, and yet we lack the legislation to fast track them or to put them to the head of the line, and is anything in the box in Sacramento or wherever? There are people that are knocking on doors and sending emails and writing letters, but I think this is the kind of thing which needs to be taken up by, let's say, the AMA or one of the national nursing sort of associations. Certainly, people in higher education ought to get behind this. You know, medical and health costs are already high enough. Why pay double for these kinds of professionals? And in many cases, have paid for professionals that we're never even going to use again. No. It's one of those crazy making kinds of situations. It's hard for a veteran to deal with that, and it's hard as an educator or as a citizen to rationalize how that can be okay.
Sunday, once again, we'll point you to our website, myfoxla.com. If you click on web links on the left side of your monitor, you will find all sorts of links there for places that you should go for more information about veterans and hiring them. Thanks to all of you for being with us. We've just simply ran out of time. This is one of those times when we wish we had another hour. So I salute all of you. Welcome home, and thanks for your service.